Hi friends, I am Dr. Chandra Mouli. I am a cardiologist and electrophysiologist at Yashoda Hospitals, Secunderabad. Today I will be discussing briefly about atrial fibrillation. Atrial fibrillation, which is a most common arrhythmia that is there in the society. We can define atrial fibrillation as an arrhythmia, that means an irregular heart rate which is very irregular. And the major risk factors for this is age and other risk factors like hypertension, overweight and sleep apnea. So I will be telling about the various treatment modalities that are available right now in India for atrial fibrillation. The first and foremost important treatment that has to be addressed in any patient with atrial fibrillation is the lifestyle modification. That means any patient with overweight or obesity or having any sleep abnormalities or having secondary diseases like hypertension and diabetes has to be addressed first and has to be controlled adequately before going further. And the next comes in the line of management is the drugs that are available. Various drugs are available for the management of this atrial fibrillation, like the rate control drugs and the rhythm controlling drugs. Once the patient is not controlled with these drugs, then there are interventions that are available for this management of atrial fibrillations. When it comes to the interventions that are available, we can tell them as in three different modalities, like the regular RFA or cryoablation, or the latest one that is going to be introduced in India called the Pulsed Field Ablation. I will be discussing about the Pulsed Field Ablation more because this is the newest modality that is going to come into India, and I will be telling about the advantages of PFA over RFA and cryo. The major advantage with PFA is the procedure is short in time, and also the complications are very minimal. We can say that the complications are almost zero when compared to the RFA. When it comes to the regular RFA, we have few complications like very dreaded complication like esophageal fistula, atrioesophageal fistula, or some pericardium. So these complications are generally avoided in a PFA. So that is one of the major advantage. But only thing I just want to stress is we have to address this issue in the early stage of the disease. So if this disease is addressed in the early stage of the disease, then the response will be good. There are chances that 80 to 90% of the times the patient won't have this disease in the future, or otherwise if the disease progresses, the response rate decrease. So at the end, I would like to conclude with only single statement that atrial fibrillation is a common disease, arrhythmic disease that is there in the society, which is under addressed, and right now if the proper care and proper treatment is taken in the early stage of the disease, the response will be very good. Thank you.
If you found this video useful, like, comment, and subscribe for more health updates.